Now we'll hear from Paula Clayton. Paula is a public health consultant to the National Association of Chronic Disease Directors, and formerly she was in Kansas as the Chronic Disease Director. So welcome, Paula.
Thank you, Marla. I'm really happy to be here to talk about an assessment that we did of decision makers, what they want to know about the evidence base for chronic disease prevention, what they do know, was kind of the focus of this project. And I have to push something here. Thank you. Okay, so I have nothing to disclose, no commercial disclosures there. Legislators' positions regarding chronic disease policies have been well documented, but current political perceptions regarding obesity policy specifically is not well known. So in this project, the National Association of Chronic Disease Directors set out to engage legislators in identifying priorities for healthy eating, active living that resonate with them in their current environments. So the results that I'll be sharing this afternoon are from what stakeholders, including the legislators, told us. And it's important to note that this project did not test messages per se. What we were doing was conducting a quality assessment to better understand the forces that are at play when we are communicating with decision makers. So our inquiry included 3 specific areas of focus, and you might recognize these as areas that CDC has invested in at the state level through cooperative agreements with state health agencies, and also areas that other national organizations, foundations, and such have invested in recent history. Our methodology was important here. We wanted to hear from people on the ground that were actually doing the work. So to do that, we conducted a multi-pronged qualitative assessment to better understand state decision makers' views that are related to policy approaches to promote healthy eating and active living. We started with a literature review and talked to state health directors and state health officers, state-level advocates from public health institutes, American Cancer Society, American Heart Association, and such at the state level, and the state legislators themselves. We also conducted focus groups of local leaders, and this included local health directors, other local leaders like city council, county commission, and such. Participants in all of these groups included people from states that have experienced success in enacting legislation or other policy in support of healthy eating and active living, as well as those that have not. So what did we learn? We did a literature review. Actually, Elizabeth Dodson from Washington University in St. Louis did the literature review for us, covering 2008 to 2017 approximately. We were looking through the literature for what we could find in terms of the use of evidence-based policy, how evidence is used by policymakers, value at the state level that drives policy decisions, messages that resonate with decision makers, and the perceived effectiveness of those messages. So the 5 takeaways from the literature review that we conducted was to target and tailor messages, concise and engaging manner, including cost data, including stories, and using data and providing unbiased information. So similar to what we've heard this morning already. From that, the information that we learned from conducting all components of the project and recommendations for how to apply this learning in work in the field is summarized in 3 topic-specific guides, one on healthy eating, one on active living, and a third on early care and education. And I've provided here the website, which you'll have in the slides, for the guides for your later reference. And what I'll do today is really just give you some of the highlights of what we learned from the project. So what did we learn? We learned quite a lot about what legislators value and care about. First of all, we heard that legislators have a lot of issues to understand. And we didn't hear anyone use the term zettabytes that we heard in an earlier session, but we did hear that scientific term of lots of data, or a ton of data. So and the other thing about that, not only do they are they inundated with information by the end of the session, but they want their information when they need it. They kind of look for it on a need-to-know basis. They don't have time to look in advance. They do listen to the business community. That was another takeaway from our learning. They're concerned very much about the state's economy and the economic impact that any policy they pass, whether it's health or anything else, they're looking at the impact that that policy has on business in the state. And they're also looking for ways to attract new business and to set the stage for businesses to grow in their states. State health officers and legislators in particular that we talked to recognized the important role of local government when we started talking about healthy eating and active living policies. Local government, when you think about it, has jurisdiction over land use, zoning, infrastructure, recreation, and et cetera. So when state decision makers consider policy, they will look to successes at the local level when choosing whether or not they would support that policy at the state level. And they also look at as whether they think it's their responsibility to do so. The informants also shared that they observed legislators who really viewed obesity, healthy eating, active living as a systemic societal issue, whereas others view that as an individual responsibility, and that also affects what policies that they support. So state legislators do look at data, but what they really want to see is state, regional, and local data rather than national data when they are making decisions. We did get some good news for state health departments here in that we heard that state health departments are considered credible conveners of diverse partners and sources of expertise for implementing healthy eating and active living. They are a voice that is credible in this space. And we also heard repeatedly that policymakers are faced with many other problems that compete for resources. And this is a constant threat for obesity prevention funding at the state level, which is compounded by declining state revenues. So what they were saying is that obesity prevention does not always rank highest in priority when legislators are considering policy. Oops. Is it moving? Where am I supposed to point at? Oh, okay, sorry. Wrong green button. Okay, so clear and consistent messages are also important to legislators. Voices from the business community carry a lot of influence with them, and state health officers further noted that the position and the level of support from the governor could not be understated and was very important in advancing any kind of policy for healthy eating and active living. They also shared that trusted spokespersons are important, and we've heard a lot about trust today, including local champions. As one key informant observed, strong constituent voices often outweigh the evidence. So what people are saying to them, trusted people, are what they are actually listening to. And the other thing that was kind of interest is that legislators are impatient. They want more substantial results than what state health departments are reporting when it comes to obesity. So what do we do with this learning? State legislators want to know what we're going to accomplish. Our informant said that generally we talk about long-term outcomes. We talk about reducing obesity, right? So what they want to know is what you're going to accomplish now. And we talk about reduction in population level obesity, and what we need to do is talk about intermediate measures. In projects like the state health departments and work on through cooperative agreements, we all use logic models. So we're used to making logic models that have short-term, intermediate, and long-term outcomes. And what we were hearing is that we need to talk about what can reasonably be accomplished in the time frames that we're talking about, and what has to happen now in order to reach those long-term outcomes. That it was not realistic to think about that we could undo 20 years of obesity increases in 12 months of a budget cycle. Providing examples of how evidence-based policy approaches from healthy eating, active living will impact the economy and community was also seen as important. We need to talk about how seniors can take advantage of the amenities of communities when it's more walkable, how they can make their towns more appealing to young families with social events and walkable destinations. We need to talk about the studies that show young people want to live in places like this. And we need to learn to better articulate how healthy eating, active living policy will bring more people to our communities and improve business prospects. The other thing that we heard, that it was great to put fact sheets and white papers together, but we need to anticipate what might come up and be ready for that, keeping in mind that policymakers are not likely to look at it until they actually need it. We need to focus conversations on priority subpopulations. And one of the two subpopulations we heard the most about were that everybody cares about kids. So if we can characterize some of what Marla was talking about, and Luis with the Verb campaign is focusing the message on kids. And the other one is tie discussions to aging in place for seniors, because we're all in the same boat. And that was another subpopulation that legislators do hear from and care about. Engaging business leaders and voices from the business community is also important. So getting them involved early on in developing proposals is important, and not underestimating the, I think I'm one ahead of myself, let's see. And don't underestimate the influence of local government in healthy eating, active living policy. While local agencies are often underfunded and may lack expertise in this area, which is one of the things that we heard about, the local government has a huge opportunity to have an impact on healthy eating and active living because they do control local planning, land use, transportation, recreation, infrastructure, and zoning. Legislators want to hear from constituents, so helping to get their voices heard was really important. I think I'm missing some slides here because they aren't matching up real well. I wanted to, how do I go backwards? The red one? Yeah, engaging. Yeah, so advice on tailoring educational messages was consistent with what we heard earlier today about messaging to decision makers. But the emphasis was on consistent messages, economic perspective, local data and solutions, impact on specific populations of highest interest, such as children, youth, and older adults. And we heard about brain development and workforce. The concern about, as we develop our new generation of workforce, how they will support us in our old age. And and then, of course, the State Health Department as a convener at the local level. Not to be dissuaded, the Health Department was seen as an entity within the state that plays a critical role in healthy eating and active living. So not to be dissuaded from working with state-level public health professionals, knowing that local governments do control the decisions on much of this, but that local advocates should tap into the credibility of the State Health Department as well. The State Health Department was seen by all the groups as having extensive experience working with communities, and they're also seen as the door to connecting with other state agencies, which we heard a lot about, the importance of how very important it is to advancing healthy eating and active living policies, having the state agencies connect to other sources within the state. And what they were talking about was the Department of Agriculture, Wildlife and Parks, Department of Commerce, and others that can not only band together in support of policies, but also have resources to add to those efforts at the local level. Decision makers did see the State Health Department as a source of expertise, and they love our data. They do look to the State Health Department for data. We have the behavior risk factor surveillance data that some have quoted today. There's the mortality, morbidity data, and other important data sets that can help and explain what the solutions might be. And that's really important since they do see the State Health Department as an authoritative voice on the topic. So finally, I would like to acknowledge my colleagues who participated in the project and thank you for your attention very much.